Good afternoon, students. In continuation of our nervous system, today we're going to learn about the nerve pathway. We're also going to learn about the cranial nerves and the peripheral nerves, the spinal nerves as well. Now we are going to go into the nerve pathway and especially with the motor nerves. Now this motor nerve pathway lies in the cerebral cortex immediately anterior to the central sulcus. Last class I told you about the brain and what all it had. The depressions are called as sulcus of the brain and the elevations are called as gyrus. So there is something called a central sulcus, if you can see in your textbook, which is the deepest sulcus of the cerebral cortex. The cell bodies are pyramidal in shape. You know the shape of pyramid is something like a triangle. So the cell bodies are pyramidal in shape and they control the skeletal muscle activity. Two neurons are involved in this pathway to the skeletal muscle, and the two neurons are the upper motor neurons, that's here, and then you have the lower motor neurons. Now the upper motor neuron descends from the motor cortex through the internal capsule of the medulla oblongata. Here you can see the internal capsule is very clearly shown in your textbook. The internal capsule is nothing but a portion inside the brain, and the description of the internal capsule is also given in your textbooks. Now here it crosses the opposite side. The upper motor neuron descends from the motor cortex through the internal capsule going down into the medulla oblongata. So with this you will understand that the upper motor neurons are traveling from the cerebrum into the medulla oblongata, passing through the central internal capsule. Here it crosses the opposite side and descends into the spinal cord. At the appropriate level in the spinal cord, it synapses with the second neuron. What is synapse? Synapse or synapse, whatever you call it, it means it conveys the message. This is the area where there is a transmission of impulse that take place. Now, once after the synapses is being done, it leaves the spinal cord and travels to the target muscles. So there is a transmission of impulse here from the brain into the spinal cord, and from the spinal cord it is being sent to the target muscle, and then the impulse is being conveyed and it terminates at the motor end plate of the muscle fibers. This means the motor area of the right hemisphere of the cerebrum controls voluntary muscle movement on the left side of the body. Similarly, the left hemisphere of the cerebrum controls voluntary muscle movement of the right side of the body. Damage to either of these neurons may result in paralysis. Now in the next slides we are going to learn in detail. In the brain there are certain areas called the Vernix Area, which is situated in the temporal lobe, ascends to the Parietal Occipital lobe. The language written, spoken, comprehension are all being done in this Vernix area. Understanding language is central and higher mental function anybody could ever have. This area is dominant in the left hemisphere of the right-handed person. Anybody has got problem with the left side, people will have problem in their right, especially if the person is a right-handed person, and if he's got hurt on the left side of his head, he might have problem with his Vernix area. So when he has problem like that, he'll have problem in writing, in understanding, and also in speaking. Now there is another area called the Parietal Occipital area. It lies behind the somatosensory area. What is somatosensory? Somatosensory is the normal sensory area which controls all over the body. It includes the Vernix area as well. its functions are thought to include the spatial awareness, interpretations of language, and ability to name an object. Now, in little children, especially those who have problem in their development, their parietal occipital areas will be assessed. Now, it has also been suggested that objects has been suggested and can be recognized by touch alone. It comes with knowledge of the past experience retained in this area. Now going to the spinal cord, which is a part of the central nervous system. We were learning about brain all this while. We are coming to spinal cord. We will also go back to the brain. The reason why I am switching from spinal cord to brain and brain to spinal cord is because their functions are interconnected with each other, and only if you learn both simultaneously will you be able to understand the functions of both, and also the complications if any single portion of the brain or the spinal cord stops working or if it's injured. Now going into the spinal cord. Spinal cord is an extension of the brain into the vertebral canal surrounded by meninges and cerebrospinal fluid. Upper border of atlas. Now if you are going to learn about the full body osteology, there are 7 cervical vertebrae from C1 to C7, and there are 8 cervical nerves. There are 8 nerves in the neck, but there are 7 vertebrae, of which atlas is the first cervical vertebra. The spinal cord, you might wonder, for 7 cervical vertebra, what is the need to have 8 cervical nerves? But here the explanation is given. The upper border of atlas, the first cervical vertebra, to the lower border of the first lumbar vertebra is the extension of the spinal cord. Now the spinal cord, we all know, is an extension of the brain into the vertebral canal surrounded by meninges and spinal cord, and from the brain it continues down by getting into the upper border of atlas. Now it is 45 centimeters in length, thick as that of your little finger. So if you can all look at your little finger, you will understand that the thickness of your spinal cord is similar to the thickness of your little finger. The spinal cord is the only link between the brain and the rest of the body, along with the spinal nerves. The nerve carries impulses from the brain to various organs of the body via the spinal cord. Sensory nerves from organs and tissues enter and pass upward in the spinal cord to the brain. Some activities of spinal cord are independent of the brain, and they are controlled at the level of spinal cord by the spinal reflexes. So whatever impulses from the brain that has to be transmitted to the rest of the body has to happen only through the spinal cord, whereas the spinal actions does not have to go to the brain to come back. It is independent of the function and it does not require the brain at all. There is an extensive neuron connection between the sensory and the motor neurons at the same or at the different level. The cross section of the spinal cord is given here. It's almost completely divided into 2 equal halves, but it's not divided, but it's almost divided. Anterior by a sharp, shallow median fissure, posteriorly by a narrow median septum called the deep median septum. It is composed of grey matter in the center and white matter at the periphery, supported by the neuroglial cells. 2 bundles of nerve fibers merge into each side of the spinal cord, which is known as nerve root. Now these are the nerve roots. Those of the dorsal nerve root carry sensory nerve impulses into the spinal cord, while fibers of the ventral carry motor impulse. Now, nerve root carrying the motor impulse away from the spinal cord. So, these are the two nerve roots. One is the sensory one and one is the motor one. Now, going into the grey matter. The arrangement of grey matter in the spinal cord is in the form of a letter H. You can see it's slightly different in color. Having two posterior and two anterior and two lateral columns. The grey column extends the length of the spinal cord containing the cell bodies of the neurons that run up and down the cord. The area of the grey matter lying transversely in the transverse commissure and it's pierced by the central canal. An extension by the fourth ventricle contains the CSF. So all these is given in the form of a H. There are more elaborate pictures that are given in your textbook. So with the write-up, if you can read with your textbook open, you will be able to understand. The nerve cell bodies belong to sensory neurons which receive impulses from the periphery of the body. Lower motor neuron which transmit impulse to the skeletal muscle. Interneurons which directly link a sensory and a motor neuron to form a reflex arc. This reflex arc is a very important question which is asked. I will also share some important question at the end of this presentation. So please follow carefully. The sensory and the motor nerve may enter and leave the spinal cord at the same time at the different level. There are two columns of grey matter that are seen. One is the anterior column of grey matter and the next one is the posterior column of the grey matter. We will go into it little later. Now we will go into the white matter. There are three columns of white matter seen, which is anterior, posterior and lateral. They are formed by sensory nerve fibers ascending the brain. Motor nerve descending from the brain and fibers of interneuron. Tracks are named based on the point of origin and destination. Sensory nerve tracts are also seen in the spinal cord. The two sources of sensation are skin and the spinal cord. Sensory receptors are stimulated in the skin like pain, heat, cold, touch and pressure. The tendons of the muscles and joints or specialized nerve endings are called proprioceptors, are stimulated by stretch, maintains balance and posture, works by three neuron system. By three neuron system, the impulses reach the sensory area of the opposite hemisphere of the cerebrum. The two neuron system, the nerve impulse reach the cerebellar hemisphere at the same level, and the motor nerves in the spinal cord are those that transmit impulse away from the brain to the other parts of the body through the spinal cord through motor neurons. Stimulation of motor neurons result in contraction of a muscle. For example, if your hand is touching something very hot, the impulse is sent to the brain and the brain sends signal to the target muscle or the target tissue to work immediately. So what happens when you touch something hot? Your hand is pulled back, and this is also a function of the motor nerve in your spinal cord. Glandular secretion. So when you are very scared, your body starts synthesizing adrenaline, which is also happening in the brain, which is a connection of your spinal cord. They control the voluntary functions of the body as well. Pyramidal or the corticospinal tract and extrapyramidal tract are the two tracts that are there in the motor nerve. What is a corticospinal or pyramidal tract? The motor nerves that are present within the internal capsule. We learnt about the internal capsule when we learnt about the pathway where the motor nerves function from the brain to the spinal cord. So same way, any motor nerve fibers within the internal capsule is called as pyramidal or corticospinal. Motor fibers that does not pass through the internal capsule are called as extrapyramidal nerve tract. Now you also have the upper motor neuron and the lower motor neuron, as we learned there, and these are involuntary muscle movements in the midbrain, brainstem, cerebellum and the spinal cord. There are lots of reflexes in the body. One, we have the sensory reflex, interneurons in the spinal cord and the lower motor neurons. Now we learned about the reflex arc. Reflex arc is one of each of these neurons. A reflex action is an involuntary and an immediate motor response to a sensory stimulus that is invariably protective. What is the stretch reflex? Cell body of the lower motor neuron is stimulated directly by the sensory neurons. Autonomic reflex. It includes the pupillary light reflex. What is pupillary light reflex? I think the optometry students will know. When they put the light in the eye, the pupil contract and relax, which is the pupillary light reflex. When the pupil immediately constricts in response to bright light, preventing retinal damage. This pupillary reflex is also a reflex where it's done on patients, especially those to check if the pupils are dilated and if they are awake, alive or dead. Now going to the peripheral nervous system. It is made up of all nerves. Peripheral nervous system is not the central nervous system. It contains only the nerves that are leaving the spinal cord. So it is made up of completely of nerves, sensory nerve, motor nerve or both. Both somatic and autonomic nerves are in the peripheral nervous system. Here also there are spinal nerves which leave the spinal cord via intervertebral foramina. You also have cranial nerve which originate on the base of the brain and flow out through the foramina from the base of the skull. Now going to the spinal nerves. There are 31 pairs of spinal nerves that leave the vertebral canal passing through the intervertebral foramina. See, this is the intervertebral foramina in between two vertebrae. So this is how they pass by. Now 8 cervical nerve, although there are only 7 cervical vertebrae is what I told you. Then we have the 12 thoracic, 5 lumbar, 5 sacral and 1 coccygeal nerve that are present. These nerves are named according to the area in which they pass through. So that's how they are named. Now going to the Cauda Equina. Cauda Equina is also known as a horse tail. Where do you have this Cauda Equina? The lumbar, sacral and the coccygeal nerve leave the spinal cord near its termination at the level of the lumbar vertebra, and it extends downwards into the vertebral canal into the subarachnoid space. Where is the subarachnoid space? Subarachnoid space is there in the brain. We learnt it in our first class. Forming a sheaf of nerves. What is sheaf? More like a collection. When after they harvest the wheat or the rice or paddy, they tie it together in bundles. I think you would have seen. That is called as the sheaf. Now it resembles a horse tail. The Cauda Equina. The anterior nerve root consists of motor nerve fiber, which are the axons of the lower motor neurons from the anterior column of the grey matter into the spinal cord. So with this we finish our presentation with the spinal cord. Now we are going into the spinal nerve. Now what is a spinal nerve? With all that I have taught you so long, you have to revise it in your head, so you will know what the spinal nerve is. Now going to the network of nerves. It lies in the neck and the axilla, formed by the ventral rami C5 to T1, and it gives rise to nerves. It innervates the upper limb. Now in this chapter we are going to learn about the different nerve plexus. Now there are three different nerve plexus that are there in your book. One is the brachial one, next one is the lumbar nerve plexus, and the other one is your cervical nerve plexus. Now before we go into the nerve plexus, let me finish about the cranial nerves and then come here. Now there are 12 pairs of cranial nerves. The first one is olfactory, optic, oculomotor, trochlear, trigeminal, abducent, facial, vestibulocochlear. Vestibulocochlear is also called as your auditory nerve, glossopharyngeal, vagus, accessory and hypoglossal. Now with the names itself, the functions of these nerves are well understood. First one is olfactory. Olfactory is something that helps in your nose and in your smell. Then you have the optic nerve, which is helping in your vision. Oculomotor are nerves that helps in your sight and also in other motor functions of your eyes. Then you have the trochlear, then the trigeminal, the abducent nerve, the facial, the vestibulocochlear, the auditory nerve. Glossopharynx means, glosso means tongue, pharynx means the throat. So glossopharynx is probably the connection between your tongue and your throat. Vagus and your vagus nerve is one of the longest nerve, and vagus nerve travels all over your body. Then is your accessory nerve, and then is your hypoglossal nerve. First going into the olfactory nerve. Now I have put it in such a way that it will be easy for you to understand, and also when you write for your exams, I want you to write your answer this way: the component, function, origin, opening in the skull, and also you are going to write about the functions of these nerve. Now I want you to write it like this in a notebook so that when you prepare for your exam, it will be easy for you to learn. The olfactory nerve is a sensory nerve. It helps in function. It originates from the olfactory receptor nerve fibers. It opens into the cribriform plate of ethmoid. Now if you have your osteology book, you can see where this cribriform plate of ethmoid is. Now this is where the olfactory bulb, olfactory nerve, olfactory tract, this is the cribriform plate of ethmoid. Now going into the second nerve, which is the optic nerve. It's also a sensory nerve, functions in vision. It's present in the back of the eyeball, and it also opens in the optic canal. Now this is where the optic nerve is present. The optic canal is here. Now going into oculomotor nerve. It's a motor nerve which you can understand from the name itself. It helps in raising the upper eyelid, turn the eyeball upward, downward, inward, medially. It constricts the pupil and it accommodates the eye. What do you mean by accommodates the eye? When you see a nearer object and then you immediately see a closer object, you are able to see both without any difficulty. So this is done by your oculomotor nerve. It originates in the anterior surface of the midbrain, and it opens in the skull at the superior orbital fissure. The superior orbital fissure is somewhere here on top. Now going into the oculomotor nerve, you can see it from this picture. Then we have the trochlear nerve. The trochlear nerve is again a motor nerve. It assists in turning the eyeball downward and laterally. It originates in the posterior surface of the midbrain. Superior orbital fissure is where it opens into the skull. Then you have the picture showing where the trochlear nerve is. Now going into the trigeminal nerve. The trigeminal nerve is a very important nerve because it has got three important nerve branches. One is the ophthalmic branch, the next one is the maxillary nerve branch, and then you have the mandibular nerve branch. Now this picture is very important. If you would draw this picture and write these three names, you will get half of the mark that your question is for. Now first we will look at the ophthalmic division of trigeminal nerve. The ophthalmic nerve or the ophthalmic division of trigeminal nerve is a sensory nerve. It functions in, it supplies the cornea, skin of the forehead, scalp, eyelids and nose. So if you have any problem with your eyelids and your nose, you can remember that you have problem with your trigeminal nerve. And which division? The ophthalmic division. Mucous membranes of paranasal sinuses and nasal cavity. Anterior aspect of the pons is where it originates from, and it opens in the superior orbital fissure. Now we are going to learn about the maxillary nerve or the maxillary division of trigeminal nerve. It has got a sensory component, skin of the face over the maxilla. It supplies teeth of the upper jaw and also the mucous membrane of the nose and the maxillary sinus and the maxillary plate, and the hard palate and the soft palate. Now anterior aspects of the pons is where it originates from, and it also opens in the skull. Now going to the mandibular division of trigeminal nerve. It's a motor nerve. It's a very important nerve because muscles of mastication. What is mastication? The muscles that help in chewing your food. The mylohyoid muscle. Where is your hyoid bone? The hyoid bone is the protuberance seen in your neck. That's your hyoid bone. The mylohyoid means the muscle function to the hyoid. The anterior belly of digastric. Tensor villi palatini. Tensor villi palatini is all present at the back of your palate. And the tensor tympani. Tensor tympani itself, with this you will understand that it's supplying the tympanic membrane of your ear. Anterior aspect of the pons, and for it opens from in the skull at the foramen rotundum. Now it is both sensory and skin of the cheek, skin over the mandible, side of the TMJ, teeth of the lower jaw, mucous membranes of the mouth, and the anterior part of the tongue. Now going to the abducent nerve. Abducent nerve is the sixth cranial nerve. You cannot change the order of the nerve names because cranial nerve 1 to 12 need to be said in order. Now going into the abducent nerve. The abducent nerve is also a motor nerve. It functions in the lateral rectus muscle, helping in the turning of your eyeball laterally. It originates from the medulla oblongata and it opens to the skull at the superior orbital fissure. Then we are going into the facial nerve. The facial nerve is a very important nerve because you will learn a lot about facial nerve when it comes to the complications or the damage to different nerves. The facial nerve is a mixed nerve. What do you mean by mixed nerve? It means that there are sensory components and motor components as well. The motor components, where all is the motor function of the facial nerve? The muscles of the face and the scalp, the scapidus muscle, posterior belly of digastric, stylohyoid muscle. Now going into the sensory functions of the facial nerve, it gives taste for the anterior 2/3 of the tongue from the floor of the mouth and the palate. So if your anterior 2/3, as in your front part of your tongue, you are not able to feel any taste, then it means there is a problem with the facial nerve. The function of the facial nerve is its secretomotor. The secretomotor means it helps in secreting something. like the submandibular and the sublingual salivary gland, the lacrimal gland, and the glands of the nose and the palate. So the salivary glands that are present in the submandibular and the sublingual region, the lacrimal glands and the glands of the nose and the palate. Now the origin of the facial nerve occurs at the medulla oblongata, and it opens in the skull at the internal acoustic meatus, facial canal, and the stylomastoid foramen. Next, going to the auditory nerve or the acoustic nerve or the vestibular cochlear nerve. The vestibular cochlear nerve is a sensory nerve. It functions in the position of your head. When people have got problems with the ear, they are not able to walk properly. So you might wonder, what is that got to do with them walking properly? But the vestibular cochlear nerve helps in the posture of the head, and it also helps in hearing. It originates from the medulla oblongata, and it also opens to the skull through the internal acoustic meatus. Now going into the glossopharyngeal nerve. The glossopharyngeal nerve is the ninth nerve. Now it's a mixed nerve. Its motor function is stylopharyngeus muscle, and it associates with swallowing. Now if there is a paralysis of the glossopharyngeal nerve, the swallowing does not take place and people tend to aspirate. So general sensation of the posterior half of the tongue and the pharynx and the carotid sinus and the carotid body are the sensory function. It also helps in the function of secreting saliva from the parotid gland. The glossopharyngeal nerve originates from the medulla oblongata, and it opens to the skull at the jugular foramen. Now going into the vagus nerve. The vagus nerve is the motor nerve. It supplies the heart, great thoracic blood vessels, larynx, trachea, bronchi, lungs, alimentary canal from the pharynx to the splenic fixture of the colon, liver, kidney, and pancreas. It originates from the medulla oblongata, and it opens to the skull through the jugular foramen. Now with this itself you can see where all the vagus nerve is been going and where all it's been supplying. The new Rosen-Williams book that is there in your library is where all these pictures are. If you can download it online and if you can see, you will be able to appreciate all these. Next, going to the accessory nerve, which is the 11th nerve. The accessory nerve is a motor nerve, and the muscles of the soft palate, the muscles of pharynx, muscles of larynx are all supplied by the cranial root of the accessory nerve. The spinal root of accessory nerve supplies the sternocleidomastoid and the trapezius muscle. The sternocleidomastoid and the trapezius muscle are the two muscles that are present in your neck. Then you learn about the origin, which is the medulla oblongata, opening to the skull through the jugular foramen. Then you have the hypoglossal nerve, which is the 12th cranial nerve. The hypoglossal nerve is a motor nerve. It supplies the muscles of the tongue except the palatoglossal, which controls the shape and the movement of the tongue. Now medulla oblongata is where it originates from, and it opens to the skull by the hypoglossal canal. Now going to your nerve pathway. The somatosensory is what we learnt about the first order neuron, second order neuron, and the third order neuron. We are going to deal little bit in detail about the first order neuron. We learnt about the first order, second order, and third order when we were learning about the motor pathway. Now what is this first order neuron? It conducts impulses from the somatic receptor into the brain stem or the spinal cord. It forms the face, mouth, eyes, and along with the cranial nerves into the brain stem. From the neck, trunk, limbs, and the posterior aspect of the head, somatic sensation is being passed along the spinal nerves to the spinal cord. Going to the second order neuron, it conducts impulses from the brain stem and spinal cord to the thalamus. Axons of the second order neuron decussate. What do you mean by the word decussate? As I said, it crosses to the opposite side. We call it as decussate in the brain stem or the spinal cord before ascending to the thalamus. Hence, somatic sensory information from one side of the body reaches the thalamus to the opposite side. Going to the third order neuron, it conducts impulses from the thalamus to the primary somatosensory area of the cortex on the same side. Now, somatosensory pathway of the cerebrum is usually from the spinal cord, and from the spinal cord it ascends to the cerebral cortex via these three general pathways: the posterior column, medial lemniscus pathway, anterolateral pathway, and the trigeminothalamic pathway. The somatosensory impulse enters the spinal cord to reach the cerebellum via the spinocerebellar tract. See, this is the ascending tract, this is where the descending tract, and posterior, lateral and anterior columns are seen here. The posterior column is usually associated with conscious proprioception and tactile sensation from all the body regions except the anterior portion of the head, ascends along the posterior column of the spinal cord and along the medial lemniscus pathway in the brain. The first order neuron extends from the sensory receptors in the trunk, limbs, neck and posterior head into the spinal cord and ascends to the medulla oblongata of the same side of the body. In the spinal cord of the posterior column, it consists of two parts. Now, these elaborate details may not be required for all of you, other than few students who are studying, physician assistants, the MRD students, the sociology students may not need to know so much in elaborate, but it's always good to know what's happening in your brain. Okay, impulses from the lower trunk and the lower limbs travel along the brain, and it synapses with the second order neurons in the medulla oblongata. From the second order neuron, it passes to the opposite side of the medulla and enters into the thalamus. So, all these are seen here: deep touch, decussation. See, it's a very nice picture for you to learn with the notes. Going into the refined sensation, proprioception, which is an awareness of the precise position of the body parts. Kinesthesia is the awareness of direction. Proprioception also allows weight discrimination, the ability to assess the weight of the object. Vibratory sensation, when there is a fluctuation in the touch and in the stimuli. Okay, so all these. Anterolateral or spinothalamic pathway is composed of three neurons set also. First order neuron connects receptors of the posterior head of the neck. Cell bodies of the first order neurons are in the posterior root ganglia. The axon terminals of the first order neuron synapse of the second order neuron, whose cell bodies are located in the posterior gray horn of the spinal cord. Now, the axon of the second order neuron cross to the opposite side of the spinal cord, pass upward to the brain stem in either the laterospinothalamic tract or the anteriospinal thalamic tract. The laterospinothalamic tract conveys sensory impulses for pain and temperature. The anteriospinothalamic tract contains tickle, itch, light, touch and pressure. All these may be asked in one word questions. The axons of the second order neuron end in the ventral posterior muscles of the thalamus, where they synapse with the third order neuron. The axon of the third order neuron project to the same primary somatosensory areas of the cerebral cortex as the thalamus. So I have all these pathways here. If you are interested to go through, you can always go through. Now there are some somatosensory pathways of the cerebellum as such. Now going into the ascending tract, spinotectal tract, spinoreticular tract, spinovestibular tract. So all these are some nerve tracts. Spinothalamic pathway, descending tracts, conscious and unconscious tracts. You have the other tracts as well: rubrospinal, tectospinal, vestibulospinal, lateral reticulospinal, medial reticulospinal. Now, cranial nerves, their axons extend from the cranial nerves to the skeletal muscle of the head. The axon in the spinal cord extends from all the spinal cord to the skeletal muscle of the trunk and the limbs. Only the lower motor neurons provide output from the central nervous system to the skeletal muscle fibers. For this reason, they are also called as final common pathway. Now all these are the different pathways that are present. In the medulla oblongata, the axon bundles form a ventral bulges known as the pyramid. Now we also learned here about nerve impulses from the voluntary movement propagate from the cerebral cortex to the lower motor neuron via the direct motor pathway known as the pyramidal pathway. We learned the pyramidal and the extrapyramidal or the corticospinal tract. So all these are interconnected with each other. So this might look very vague when you listen to the class, but when you keep reading it twice or thrice, you will be able to understand how the whole function works. You might think you are not a neurosurgeon or what is the importance, but as a human being with having all these parts present in our body, I think it's very important that we learn how our brain functions. Now 90% of the axon of the upper motor neuron, UMN is the upper motor neuron, cross over to the collateral side or the opposite side in the medulla oblongata. 10% remain in the same side. Eventually they crisscross at the spinal cord level and they synapse with the interneuron or the lower motor neuron. The right cerebral cortex controls the muscles of the left side of the body, and the left cerebral cortex controls muscles of the right side of the body. There are three tracts or parts of the motor pathways: the lateral corticospinal tract, okay, and then you also have the coordination of the limb movements that are here. You have anterior corticospinal tract, see how the nerves are being, how the impulses are being sent. Okay, so these are the different bulbar tract, corticospinal tract. All these are put here for you to read and to understand. Now we are learning about the indirect motor pathway, which is the extrapyramidal pathway, where the nerve impulses conducted along with the indirect pathway follow complex polysynaptic circuits. What do you mean by polysynaptic circuit? There are lots of synapses that take place that involve the motor cortex, basal ganglia, thalamus, cerebellum, reticular formation, and the nuclei of the brain stem. Okay. These are the functions of the indirect motor tract or the extrapyramidal tract. What are extrapyramidal tract that does not pass through the internal capsule are those that are called as extrapyramidal tract. The rubrospinal tract, the tectospinal tract, vestibulospinal tract, medial and lateral reticulospinal tract. There are something called as upper motor neuron lesion. We will learn about all these different lesions in the damage and the disorder and the dysfunction, but just as a sake of completion I am putting all this here. Spasticity. The word spasticity means difficulty to flex and extend a part of your body. Hypertonia, hyperflexia, disused atrophy, and positive Babinski's sign. Lower motor neuron lesion, you have flaccid hypertonia, hyperflexia, minus or the negative Babinski's sign. So all these are there for you to read and understand. Now, what supplies blood to the spinal cord? The spinal cord receives blood supply from two main arteries, the posterior spinal artery and the anterior spinal artery. The posterior spinal artery arises from the vertebral artery, divides into two descending branches, and it runs downwards, and it's close to the posterior spinal nerve root. The anterior spinal artery arises from the vertebral artery, unites to form a single artery which runs down within the anterior medial fissure. Now the posterior and the anterior spinal arteries are reinforced by radicular artery which enters the vertebral canal through the intervertebral foramina. Now this is a picture of the arterial supply of the spinal cord. Okay, so you have all these. Now we will go to the brachial plexus. We learnt about the cranial nerves, we learnt about the spinal nerves. Now we are going into the brachial plexus. The 5 ventral rami is where it is connected, C5 to T1. The upper, middle and the lower are the nerve trunks. When you write about the cranial nerves, I told you how to write about the origin, insertion, function and also the area of supplying. Now when we write about the different nerve plexus is nothing but the network or the branching of nerves. You have to write it in form of root, trunk, division, cord and branches. Now for example, if you have a question about the brachial plexus, this is how you are expected to write. Roots, trunks, division, cord and branches. Now behind the scalenus anterior, emerge between the scalene muscle, the trunk of the nerve plexus, it crosses the lower part of the posterior right triangle of the neck. Division behind the clavicle, arrangement at the second part of the axillary arch in axilla, supraclavicular part and the intraclavicular part, roots and trunk, cords and branches. So you have to write your answer this way. When you write your answer this way, you will get your marks very easily because you don't have to read through your paper at all. And you will also have to draw this diagram. Okay, you have root, trunk, division and the different cords. See, I put this picture for your better understanding. C5, C6, C7, C8 and T2 are the vertebrae in which the brachial plexus start to function. Now the brachial plexus, and this diagram is very important for you to understand how the brachial plexus work. Now the C5, C6, C7, C8, T1 are the roots. The upper trunk, middle trunk and the lateral trunk are the three trunks, and then you have the cord, lateral cord, medial cord, posterior cord, and then you have the divisions in which it supplies. Now going into the branches, three roots, one trunk, no divisions, cords. Now from the roots you have the dorsal scapular nerve, nerve to the subclavius, long thoracic nerve. From the roots, these three nerves are seen. From the trunk you have suprascapular. Suprascapular is the scapula that is there in the back of your shoulder. It supplies the C5 and the C6 vertebra, and the brachial plexus nerves are given here. Lateral pectoral, lateral root of median, musculocutaneous. What do you understand by musculocutaneous? You understand it as the nerve root that supplies the muscle and the skin. The medial cord supplies the medial pectoral, medial root of the median nerve, medial cutaneous nerve of the arm, the ulnar nerve. The ulnar nerve supplies your hands. Now posterior cord supplies upper scapular, thoracodorsal, lower subscapular. Now musculocutaneous are anterior compartment of the arm. The medial is most flexor muscle of the forearm, and ulnar you have the intrinsic muscles in the hands. Axillary is the deltoid area, and then the radial innervates the extension of the muscles of the arm and the forearm. Dorsal scapular nerve arises from the C5 and C5 root, and it runs posterior. It supplies the posterior aspect, runs down deep to the levator scapulae and the two rhomboid muscles. So all the names of these muscles are given in your textbook, so it will be easy for you to see. And it supplies the levator scapulae muscle and the two rhomboid muscle. Now going to the subclavius nerve, it's small and it arises near the junction of the C5 and the C6, descends anterior to the trunk of the plexus, connected to the phrenic nerve, and it also supplies the subclavius. Now this is where you have the Erb's point. The long thoracic nerve, it arises from the root of C5, C6, C7, forms the first digitations of the serratus anterior muscle, and the nerve it supplies is given here. Okay, now it supplies the supraspinatus muscle, infraspinatus, articular rami of the shoulder, and the upper scapula is here, and then you have the lower scapula. Thoracodorsal nerve, the explanation is given here. It accompanies by the subscapular artery along with posterior axillary wall. There are damage that can take place to the brachial plexus, like the entire plexus can get damaged, the long thoracic nerve can get damaged, you can have Bell's palsy, you can have upper trunk palsy, lower trunk palsy, injury at the level of the cord, musculocutaneous injury, the brachial plexus block. So all these are the different ringing of the scapula. All these are the different complications that take place with the brachial plexus. Now we also have the see, we also have the cervical plexus, claw hand we all have seen in our leprosy patients, and here the explanation for the claw hand is given. Now all these are a resultant of any level of damage that take place in the brachial plexus. Now I want all of you to go through the brachial plexus, and with this you are completing your understanding of your the different nerves and the nerve roots. In your next class I will deal with the complications, and in between if you have any doubts or if there is any chapter or any portion that you are not able to understand, please email to my email address. I will clarify your doubts, and the important questions I will give at the end of the next class after we finish about learning the different complications and the damages that can take place to the spinal nerves, the cranial nerves, and also the central nervous system and the peripheral nervous system. Thank you.